முதல்ல தொடங்குவோம். Hello. Can you hear? Clearly?
Okay, sir. Continue.
There are diseases. Or is there any difficulty in hearing? AC போடுறா.
ஏழு செகண்ட் லேட் ஆகும் சார். 5-7 நிமிஷம் லேட் ஆகும். அது வந்து ஜிக்னாஸாவோட சைடோட எஃபெக்ட். சார் நீ கண்டினியூ பண்ணுங்க சார். ஸ்லோ 7 செகண்ட் லேட் ஆகும். பரவாயில்ல. கண்டிப்பா இது அதாவது ப்ராட்காஸ்ட் வந்து டிலே. கண்டிப்பா.
ஆன் பண்ணி விடு.
அது ஆன் பண்ணி. இது கிளியர் ஆயிடுச்சு. கண்டினியூ பண்ணுங்க சார்.
Dear viewers, there was some difficulty. Our people are trying their level best to correct it. They say it is corrected now. I am going to start from the beginning. Cardiology, many people think it's very difficult. Ayurveda means we have to treat only Vadarakta, Sandhivada, Bhakshagada, Vicharchika, Kushta, Tamagaswasa, autism, old CP, and chronic psoriasis. So it is not like that. Many of the cardiac conditions are successfully treated by Ayurvedic doctors. Except few conditions like ventricular tachycardia, ventricular arrhythmias, ventricular fibrillation, acute atrial fibrillation, and acute MI, we may be able to treat many conditions successfully. And very few people use dosha vigalpa in their practice. They randomly give Arjunarishtam for everything. Arjunarishtam, Arjuna is Kashaya Rasa, Ruksha, Kafagara. How can you give it in Pittaja, Hridroga? So, random usage of Arjuna Rishtam is not correct. We are going to talk about everything in detail. It is a series of classes. I am going to talk about cardiology. 1 or 2 classes I will be talking about cardiology. Then I will be talking about neurology, pulmonology, like that. We will announce the next class at the end of the session. It is one of the trimarmas. Vasti is Vadapradanya Sadyapranagaramarmam. Hridayam is Pittapradanya Sadyapranagaramarmam. Shiras is Kapapradanya Sadyapranagaramarmam. It is one of the Pratyanga and a Koshtanga. Hridayam is a Ura Marma. There are other marmas in Uras like Stanamula, Stanarogida, Avastamba, Avalaba, etc. The origin of Pranavaga and Rasavaga Srotas is Hridaya. It is a seat of Rasadadu. It is Pranayadana. Hridayam is the one of the Pranayadana by Charaka and the seat of Chedana and Manas. In addition to this, it is one of the Trimarmas. It is a seat of Ojas. And Dasha Pranayadanas, you know that there is an Adhyayam. Hridayam is one. Nabi, probably Nabi here denotes the superior vena cava region. Kantam, carotid vessels. Raktam, Shukram, Ojas. Ojas is immunity. All the plasma proteins and immunoglobulins come under the spectrum of Ojas. They are the physiological components of Ojas. You have a psychological component of Ojas. And you have got a spiritual component of Ojas, immunity. Balam is Trividam, Vada Balam, Pitta Balam, Kapha Balam. Vada Balam, Balam Tasehi, Vid Balam, that is Radhechma. Pitta Balam, Agni Mule Balam Pumsad, Agni is everything. And Agni Balam is Grahani. And Pragadas Balam Sleshma, that is Pramegam. Now, Hridayam is an emotional center, Chedana Adhishtana. Ramana Maharishi used to tell his students to meditate on the heart's right side. And many people meditate on the Ajna Chakra, the seat of Manas and Paravojas, Ashtabindu Pramanam, Aparavojas, Sarvanga Sarira Vyabhi. The main seat of Aparavojas are 10 Damanis connected to Hridaya. The quantity of Ojas is half Anjali. It is also known as Sleshma Ojas because its properties are similar to Sleshma, and it is derived from Prasada Pagam, Shonida Pagama and Kapha of Matruja Bhava. It is derived from the mother. During the fetal period, Dvihridaya is mentioned. If the desires of the 4th month woman is not fulfilled, Jadam, Vamanam, Vigaraksham, Anaksham, Putram Va, Sudam Janayadi. So they will deliver children with congenital anomalies or intrauterine growth retardation. So Nirukti of heart is Haradi, Datati, Yati, Iti Hridayam. Haradi, it collects the blood. Dadadi, it gives the blood. Yadi, that blood circulates all over the body. Systolic, diastolic and circulation. Cardiac input, output and circulation. Heart looks like Kamala, Dravya Samanyam. Pundarigena Sadrisham, Hridayam Va Adomugam. And it is 4 angulas in size. Vyanavayu, Sadaka Pitta, Avalambaka Kapha are present in the heart. Sarangadara says Hridayam is involved in the respiration also. Vyanavayu does the circulatory karma. Hridrogam is not mentioned as a Maharogam in Ayurvedic classics because Jwaram, Kasam, Rasayanam, Gulmam, they are all very big chapters. Hridayam is a very small chapter, but there is a very interesting thing what we are going to see. Heart is considered as a source of emotion, courage and wisdom. People experience the feeling or sensation of love and positive emotional states in the area of heart. Its nervous system contains around 40,000 neurons called sensory neurons which detect circulating hormones, neurochemicals. It senses the heart rate and pressure information. The hormone atrial natriuretic factor is produced and released by heart. It is a vasodilator. It reduces water and sodium and adipose loads on the circulatory system. Now there is an interconnectivity between intrinsic ganglion and the human heart. The heart communicates with the brain in 4 ways: neurological communication, biochemical communication by hormones, atrial nucleatic peptides, biophysical communication, pulse waves, energetic communication, electromagnetic fields. Heart is most important endocrine gland. In response to our experience of the world, it produces and releases a major hormone, ANF, that profoundly affects every operation in the limbic structure, which we refer as emotional brain. Limbic system, hippocampus, and reticular formation, they are very closely associated with the site of mind. We cannot say Ayurvedically, being an Ayurvedic doctor, Sugati Balapti Sadhanam Indriyam Manaha, Manyadeva Butyade, Nyayade, Anene Manaha. Mind is the, modern medicine say mind is the, one of the cortical functions. So they have found out that the emotional aspect is related to limbic system, hippocampus, and reticular formation, and a lot of work is going on prefrontal lobe for calmness, etc. That's why we are meditating. Many meditating subjects were subjected to functional MRI, and they found density of brain increases. So the primary structure within the limbic system include amygdala, hippocampus, thalamus, hypothalamus, basal ganglion, etc. It contains intrinsic cardiac adrenergic cells which synthesize and release catecholamines, epinephrine and dopamine. It also secretes oxytocin. The heart is one of the major governors of the entire human experience. The heart governs the limbic structure, which governs our healing systems. Men with high anxiety, chintyanam adichintanad rasaha sampradushyati. Men with high anxiety are up to 6 times more likely to suffer from sudden cardiac arrest. Worry about worry about social conditions, health and personal finances significantly increases the risk of coronary artery diseases in older men. Depression, autonomic nervous system affected. You have got a condition, you read in the book, dysautonomia. There is a condition called dysautonomia. You can see in MEPS, mitral valve prolapse syndrome. Depression, hypoglycemia, panic disorder, sleep disorder, asthma, fatigue, dizziness, anxiety, irritable bowel syndrome, fibromyalgia, hypertension, chemical sensitivity, premenstrual syndrome, migraine and arrhythmias, PVC, premature ventricular contraction, PAC, ectopics, extrasystole, are related to stress. When there is stress and emotional imbalance, you get all these things. Coherence. Now we talk about a word called coherence. 2 branches of ANS, sympathetic and parasympathetic, synchronize with one another, and there is overall shift in autonomic balance towards increased parasympathetic activity. That is what we want. This is also increased physiological entrainment. Entrainment is synchronization. A number of different bodily systems functions synchronize into a particular rhythm. That is the rhythm of the heart. That synchronization happens between heart and brain because of these subtle hormones the heart produces. Now we have insulin, glucagon and somatostatin. Insulin is a kapha hormone, glucagon is a pitta hormone, somatostatin is a vata hormone. Insulin has got an anabolic effect, glucagon has got a metabolic effect, somatostatin has got a catabolic effect. And if you see this activity, vata has got sympathetic dominant activity, kapha has got parasympathetic dominant activity, pitta has got sympathetic parasympathetic equivocal activity. Now, my dear students, hear this very, very carefully. Hear this very carefully. Our Shastra says, Veganna Daraye. Don't control the Vegas. Udiranam Gadimadam, Udinanam Chanigraha, Sevanam Sagajanam, Narinam Adisevanam, Karmakala Divadasya, Mityarambasya Karmanam, Vinyachara Lopasya, Bujyanam Abigarshanam. They are telling all these things, and they tell Prajnavaradam Janiyat, Sarvadosha Pragovanam, Udiranam Gadimadam Udirananam Chanigraha. Controlling the urges and forcibly expelling the urges. Now, my dear students, there are 13 to 14 Vegas in the body. The 13, 40 Vegas are explained in Roganutpadaniyam Adhyayam. You can see it in Udavartam also. Udavartam, untreated Udavartam can end up in stroke also. Udavartam is a beautiful independent concept in Ayurveda, like Gulmam. Gulmam also we have to talk very much, because for a Kaya Chikitsa doctor, Gulmam is a Hridaya Sthana. We select many medicines for heart diseases from Gulma Prakarana. So Gulmam is very important chapter in as far as heart disease management is concerned. Now we come to these 13 Vegas. Among the 13 Vegas, 3 Vegas are Ubastamba, Aharam, Nidra, Abramacharya. Aharam is the fuel demand produced by Pittam to sustain Pittam in the body. Nidra is the fuel demand produced by Kapha to sustain Kapha in the body. Abramacharya, Gramya Dharmam, sex is the fuel demand produced by Vada to sustain Vada in the body. Now, the first Vega, you see the sympathetic ganglions. If you, one day I was sitting by night 2 o'clock, I got an idea. I draw all the ganglions of Vegas starting from Adovadam to Nidra. Then I took Gray's anatomy and compared with the ganglion. All these Vegas in a particular order told by our Acharyas synchronized with sympathetic and parasympathetic ganglion. So autonomic nervous system disorder you cannot control. Autonomic neuropathy, there is no management. This is visceral. I can flex, I can extend, I can flex, I can extend, I can lateral bend, I can rotate. But I cannot, you will be closing while you are sneezing. You will be closing the eyes. Will you be able to stop it? No, you will not be able to stop it. So all these Vegas, Adovagam, Sukram, Mutralam, Malamudgaram, Shrutu, Trishna, Shavadu, Kasam, Jirumba, Asuru, Nidra, all these Vegas reflexes are from autonomic sympathetic nervous system. All the ganglions, I can explain one whole day about these ganglions. In parasympathetic also, you have all these ganglions, ciliary ganglion, submandibular ganglion, subambular ganglion with Trishna. Now you see this Asru lacrimation, superior cervical ganglion, and the parasympathetic pathway is there. Shavadu is sneezing, that is superior cervical ganglion. Nidra is medulla oblongata, vagus ganglion. Redas inferior mesenteric ganglion, L1, L2, S2, S3, S4 is the parasympathetic pathway. Now you come to the sympathetic pathway of Vegas. Why I am talking about Vegas? Why should I talk about Vegas in Hridroga? I will talk about that. Nidra, sleep, you have cervical, superior cervical ganglion, Asru, Jirumba, Kasa, Shavadu. Then Trishna, Shuddh, Chardi, Udgara, you have celiac ganglion. Then Malam, Mutram and Sukram, medulla, you have inferior mesenteric ganglion. Now, my dear students, my dear doctors, among the 13 Vegas or 14 Vegas, in 11 Vegas, Hridroga is mentioned. Hridroga is mentioned. Adovadam, Hridrogam, Apanavayu, Sakrut, Hridayasaya Uparodam, Mutram, Hridayasaya Uparodam, Sukram, Hridaya Vyadam, Udgaram, Hridaya Vabandam, Bashpam, Hridruk, Kasam, Hridayamayam, Shramaswasam, Hridgadam. So, all these Vegas, that is way, Vegannadarayed, 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 they are repeatedly telling. So, beautifully, I have explained. I can talk about these ganglions for hours together, but within 1 hour I have to finish. So, there is sympathetic and parasympathetic pathways are beautifully explained in the concept of Vegas. I have made special drawings which 100% match with the Gray's Anatomy textbook. So Nidanam of Hridroga, Aharam, Kleda Vardhanam. Kledam is Ushna Snigdam, Kledam is a Pitta Progo Velakshanam, Premegam is a Kleda Vriddhi Rogam, Kushtam, Kleda Rogam, Sovam, Kleda Rogam, Visarpam, Kleda Rogam. All these things are Kleda. Ushna Snigdam is Kleda. Snigdam and Kledam are different. Snigdam can be Shida Snigdam or Ushna Snigdam. Kledam is Ushna Snigdam. Ushna Snigdam is Abhishandi. Dadi is Abhishandi. Masham is Abhishandi. Tilam is Abhishandi. Masyam is Abhishandi. all Uttaradailam is sufficiently. So Ushna Snigdham is sufficiently. Vasanta Rudu is sufficiently. So Abhishanti Agaras play a major factor for the formation of Hridroga. Asya Sugam, Sapana Sugam, Kashaya Tiktarasa Agaras, Madhura Snigdha Gudu, Ajirna Agaras, Ama Bhojanam, in Anna Raksha Vidhi, Hridaya Varana Rasam, for Bishop protection, which affects the heart. Swarnabhasmam is told, Adhyashanam, Vegavarodham, Shramam, exertion, you get heart problem, negative feeling, anger, emotion, depression, hostility. They are the causes for Nidhanam of Hridroga. And above all, Hridrogam is contraindicated for most of the Panchakarmas. And one of the complications of important Panchakarma is Hridroga. Hrid Prapti, Urdhva Prapti. Hope you remember all these things. Now coming to the Vada, the Hridrogas. Sram Savyasa Vedaswava Sadhar Toda Vedanam, Sanga Anga Banga Sankoja Varta Karshana Tarshanam, Kamba Parusha Sausirya Sosha Spandana Veshanam, Stambaha, Kashaya Rasado Varana Shavo Arunobiva, Sramsam, mitral valve prolapse is Sramsam, Sankoja, mitral stenosis, aortic stenosis, Urdhva Pravritti, Udavartam, aortic regurgitation, mitral regurgitation, Spandanam, rhythm abnormality, atrial fibrillation, tachycardia. When the heart rate is less than 60, you have bradycardia. Less than greater than 120, it is tachycardia. But while sleep, the heart rate can go up to 50 or 40. For even a good athlete, the heart rate will be around 40 or 50. You have ectopics, misbeat, up to 4 misbeats per minute is normal. If you walk when misbeat goes away, that is also normal. Premature ventricular contraction, premature atrial contraction. Pitta Hridrogas, you have endocarditis, pericarditis, myocarditis. Kapha Hridrogas, you have atherosclerosis, congestive cardiac failure, bradycardia, LV dysfunction, diabetic cardiomyopathy. They respond to our treatment. Kapha Hridrogam is practically seen. If suppose a person is there, Vidaryadi is having Hridyam property, bradycardia is there is Chalaguna Vriddhi, Manda Avaranam, Chalakshayam, Manda Avaranam, pulse rate comes down. You have to give Kadurasa Aushada, which will increase Vada dosha and reduces Kapha dosha. If you give Vidaryadi or Kushmandam, even though they are Hridya, they cannot solve the problem because they are Madhura Kleda Snigdha. So you will be giving Kadurasa Pradhanya Aushadas like Tippali, Vacha, Arjuna Rishtam, Kasturi Gudiga, Goro Janadi Gudiga here, Lasuna Rasayanam, Solpa Lasuna Bintam, which will be increasing the Chalaguna because of the Kadurasa, and the Mandatva of Kapha will come down. So LV dysfunction also you will be doing like that. Cardiomyopathy, we treat so much of cardiomyopathies successfully. Now Kapha Vada Hridrogam, Gulmam is Kapha Vadam. That is why Gulmam, lot of aristas, lot of churnas are told in Gulmam. Vada Kapharogam, already I have told so many times, but many new audience are always increasing for our class. For Vadam, you have got Rasam, Madhuramala Lavanam. For Pittam, you have got Rasam, Tikta Kashaya Madhuram. For Kafam, you have got Rasam, Kadudikta Kashayam. Vada Vittam, Madhura Rasam, Pitta Kafam, Tikta Kashayam. But for Vada Kafam, there is no Rasa available. It is the Virya Pradhanya Chikissa. Gulmam, you have all Ushna Virya, except in Pitta Gulma, Nilini Gridam, Abhushadi Gridam, Abhushadi Churnam, except a few things, all these things. Now, general plan of treatment, Agni Divanam, Vadanalomanam, Srodo Shodhanam, Leganam, Hridyam, Amlam Hridyanam, Gulma Chikissa, Udavarta Chikissa. It is a 3 days class actually. Whatever possible I will finish. Next thing I will continue in the next class. Now Hridrogam. So anything already I told, Vada Samanam, Pitta Samanam, Kapha Samanam. Medium. The word medium. Medium is told in Tikta Skanda. You have Vada Medium, you have Madhura Medium, you have Tikta Medium. Madhura Medium, Vada Pitta Samanam, Gridam. Tikta Medium, Manduga Barani, Pitta Kapha Samanam. So Hridyam, Vadasamanam Hridyam, Pittasamanam Hridyam, Kaphasamanam Hridyam, Vadasamanam Hridyam, rhythm abnormality where you will be giving Prishnibarni Kshira Kashayam, Pitta Samanam Hridyam, myocarditis recovery, you have Kushmanda Rasayanam, Kapasamanam Hridyam, IHD, you have Resonadi Kashayam and Navagagukulu. Now, Shat Rasa Prayogam in Hridya. So, Madhura Rasam, mitral valve prolapse, Vidaryadi Kashayam, Hamla Rasam, hyperhomocystinemia, homocysteine. Probably you will be knowing about homocysteine, uric acid, and high sensitive C reactive protein as an inflammatory marker in the formation of ischemic heart disease. Hridya Ganadravyas, Lavanam, non-cardiac chest pain, Amlena Sakasamyuktaha, Satishna Lavanorasaha, Madhuryam Pajade Atyartam, Krishna Bhavam Mumjadi, Krichran Gulman. So, Hinkavajadi Guliga is a Hridya Dravya. Kadarasam atherosclerosis, you have Pippali. Kashaya Rasam, DM cardiomyopathy, you have Kataka Kadiradi Kashayam. Tikta Rasam Hridrogam, even in Tiktaka Kashayam, in Pitta Hridrogam, you can give. Hridya Ganam contains Amla Rasa Dravyas. Important clinical conditions. First, we will talk about a very common, simple condition called mitral valve prolapse. Mitral valve prolapse was diagnosed only after the invention of echo. Mitral valve prolapse occurs when the flaps of the heart mitral valve bulge into the left atrium. Mitral valve prolapse sometimes lead to blood leaking called regurgitation. Most of the people, mitral valve prolapse will not produce any problem. Once you diagnose through echo, they come to you with the reports telling that there is a leak in the valve. They need reassurance. You have to reassure and give achara rasayanam to them. Some people have symptoms, irregular heartbeat, arrhythmias, dizziness, difficulty in breathing, dyspnea, fatigue, and that is called MVPS, mitral valve prolapse syndrome, dysautonomic, that is sympathetic and parasympathetic imbalance. It is called Barlow syndrome, floppy valve syndrome, milling mitral valve syndrome. Nobody is using all these words. Marfan syndrome, Marfan, a tall person, inherited disorder with connective tissue disorder. Marfan syndrome commonly affects heart, blood vessels, and skeleton. They are usually tall and thin, and there will be disproportion. The vertical height and the horizontal length. The horizontal length is more than the vertical length. They have a. Will they see my hand in the video? Okay. So you see, have this thumb sign. The thumb will be protruding. This is called a thumb sign. This is called a ring sign. I have incorporated thumb sign and ring sign from these anthropological measurements to assessment of Prakrtis. We have got developed some 8 signs, Dr. Mahadevan sign, that is used for finding the Prakriti. You have a plantar response, the plantar response, flexor plantar response. You have a flexor plantar response for Vada. You have a flexor plantar response for Prakrita Pitta. You have a flexor plantar response for Prakrita Kapha. It is very interesting. Then Ehlers-Danlos syndrome. This is also another group of inherited disorder affecting the connective tissue. Epstein anomaly. It's a rare heart defect that is present in the birth. I have not seen that. Muscular dystrophy. We see a lot. And muscular dystrophy, some people say Pidichal should not be done. Navarakpidi should not be done. They do Udvartana. They do Sunarasayana. They do Dibandamuladivarti. They give Tippali Vardhamana, Chitrakarasayana, the result is same. Then when some people will Brahmana, they do Mamsakri, Chiravasti and all, the result is same. So in my clinical practice of 24 years, muscular dystrophy is a very difficult condition to treat. Likewise, hypertension, whether it is Vadada, Pittaja or Kafaja, you should be having Vada hypertension, Pitta hypertension, Kapha hypertension. That is what I feel. Because if it is Vadada, if you give Gandharvastadi, Vaishwanaram, Dasamula Haridagi, Sukumara Legam, it should come down. If it is a Pitta hypertension, Drakshadi, Kachuradi, Chiravala Talam, Kalyana Kulam, Virejanam, Thirurth Virejanam, Mridvigadi Paniyam, Shatanga Paniyam, it should come down. If it is a Kava condition, Varunadi, Navagagulu, Rasonadi Vadi, Rasunat Chiravagam, Dasamula Haridagi, should bring it down. These things are not happening once you treat hypertension. I met a doctor in Chennai. The Chennai, that doctor is called Shuddha Ayurveda doctor. Shuddha Ayurveda doctor, they do not use stethoscope, they do not use weighing machine, they do not use thermometer. I told I use weighing machine in my hospital. Then they told me, you are Ashuddha Ayurveda doctor. Why? Charaka didn't use thermometer. So there is a group of community which follows Shuddha Ayurveda. They use stethoscope only for checking BP. Other than that, they don't use stethoscope for any other thing. Many Ayurvedic doctors use stethoscope for only BP. So these are all the varieties that exist. Now Graves disease hyperthyroidism, you have this MEPS. Scoliosis is also produced. Although most of the mitral valve prolapse, it is a Vada the Hridroga with some quality, Rasadadu, Vada Vriddhi, Chala Vriddhi, mitral regurgitation, Udavartam. Usually you take an echo and mid-systolic click. If you keep in the apex area, you will be able to diagnose that. Mostly young women with anxiety, they will come to you. Modern medicine, they give beta blockers. Very, very rarely diuretics and heart rhythm medications like amiodarone are given. Amiodarone is a very toxic drug, very good drug, but a toxic drug. It is harmful for our liver. And aspirin, reassurance, yoga, meditation, rest. People talk so much about yoga, so much about meditation. Now, Ayurvedically, Brigatyadi Kashayam, Nayobayam Kashayam, Brigat Nayobayam Kashayam, Bala Jiragam Chundi, 50%, Stiramulam, 50%, then Danvandara Guliga, Prabhakaravadi, Manasamitram, like that, Shatfala Gridam, like that, or Kalyanaga Gridam, you have to give. Vayu Guliga and Danvandara Guliga are different. Vayu Guliga contains Hingulam and other metals, so you should be very careful about the Vayu Guliga. Danvandara Guliga you can give with Panasapatra, Panasabrinda Kashayam. It's a very unique Anubanam which is not told by anybody. Dhanvantaram is told in the very later text in Kerala, but Dhanvantaram is like paracetamol in modern medicine. Without Dhanvantaram, you cannot practice Ayurveda. Dhanvantaram is the backbone of Ayurvedic practice. Wonderful drug. Brahma Rasayanam. Brahma Rasayanam is Ayush Kami Rasayanam. There is no Vyadi Pratiniga Palasruddhi in Brahma Rasayanam. There are only Dosha Pratiniga Palasruddhi in Brahma Rasayanam. It is called Abhayamalaka Rasayanam. It is called Ayush Kami Rasayanam. It is the first Rasayanam. It contains 100,000 Haridagis and 3,000 Amalakis, and it is given for general day-to-day features. Kalamam, Tandram, Glani, Srama, like that. No Vyadi Pratiniga Palasruddhi is mentioned, but Vyadi Pratiniga Palasruddhi is mentioned in Avarana, Vadarakta, last, Abhaya, Amalakasyava, Kshirabala Tailam, Madurarasam, Maduravibhagam, Shitaviryam, Snigdavadam, Vadavityasamanam, Hridyam. In the second phase, Vidaryadi Kashayam, Sthiramula Kshira Kashayam, Arjuna Kshira Bhagam told Arjuna is Kashaya Rasa, Arjuna is Ruksha, Arjuna is Shida, Arjuna is Vadavardhana. So Arjuna Kshira Bhagam, when it is prepared, it is not so much Vadavardhana, and you can add Kshirabala Avarti in that, and you can give. Mitral regurgitation is the most common type of heart valve disorder. This may lead to congestive cardiac failure. Mitral regurgitation may begin suddenly. This often occurs after heart attack. When the regurgitation does not go away, it is chronic infection to the heart. Previously, when I was young, when I was studying, when you go to a dentist, if you have mitral valve prolapse and mitral regurgitation, trivial regurgitation, you are advised to take antibiotics before and after the dental procedure. That is why I remember 2 grams of amoxicillin 2 hours before the process and 1 gram of amoxicillin 1 hour after the process. That was the dosage. Now they found that it has no role, and gum infection can produce infective endocarditis. So gum has got a lot of connection with the heart. That is why dental hygiene is a very important thing which should not be ignored in the management of heart diseases. Rheumatic heart disease. Many people treat ASO. When ASO titer is positive, they start penicillin. That's not needed. ASO should be correlated with clinically. Take echo, check ESR, check CRP. Then Lakshanam you understand, Avastha you understand. You call it Amavadam, Vadaraktam, that is your choice. the way in which you are trained, you can name it and you can treat it. So, just by seeing ASO alone is treating a condition is not correct. A heart attack damage the mitral valve, and infection can destroy the mitral valve, and the mitral valve regurgitation produce cough, fatigue, rapid breathing, palpitation, dyspnea, walking make it difficult, all these things, and extra sound. Yes, for gallop, we call it atrial gallop, and crackles in the lungs if fluid backs up into the pleural effusion is there, ankle and leg swelling, enlarged liver, that is called cardiac cirrhosis, bulging of neck veins. You have subclavian pulsation, sometimes you have jugular pulsation, you have carotid pulsation, you have brachial pulsation, you have dancing brachialis, all these things. Clinical medicine is basic anatomy plus common sense. Clinical medicine is common to Ayurveda, Allopathy, Siddha, Homeopathy, Umapathy, Venkatajalapathy, everybody. Without clinical medicine, 2 plus 2 is 4. So what is the big thing? Anybody can buy a Nadaswaram from the shop. Anybody. If you go to a musical store and buy a Nadaswaram 2,000, 3,000 rupees. But Karakurchi Arunachalam plays Nadaswaram. You also play. You will be, once you play Nadaswaram, all the evil spirits will go away. But when Karakurchi Arunachalam plays Nadaswaram, all the Devadas will assemble there. So, steth is an instrument. You need intelligence and logic to interpret it. So, by good stethoscope is like a good wife, and keep your stethoscope with you. And echocardiogram, you understand, echo is taken to understand the pumping and the valves, and ECG is to find the heart attack and the rhythm of the heart. Rhythm of the heart, ECG is needed. Interpreting ECG is also appreciable. By hearting Ashtanga Hridayam is also appreciable. Both are appreciable. If you can interpret ECG, find a heart attack and ask him, give him a first aid and send him to a cardiologist and tell that they will do better in your case. Is it a criminal mistake? Is this against Ayurveda? No. If I am able to save a life like this, I would like to do it again and again and again, my dear students. Now, atrial fibrillation is a complication. Atrial fibrillation, if you see the ECG, EKG, there will be a varying RR interval, P wave will be absent, there will be fibrillatory waves. That's one of the commonest cause of embolic stroke, atrial fibrillation. Young women come to you with a stroke, you rule out mitral stenosis, atrial fibrillation, lupus erythematosus, homocystinemia, carotid atherosclerosis. Clots that can travel to other parts of the body like lungs and brain, pulmonary embolism and all. I will talk about lung diseases elaborately in my class on pulmonology, which is going to come. Aortic valve stenosis. Aortic stenosis, mild to severe stenosis. Aortic murmur, diamond-shaped systolic murmur. Mitral stenosis, you have low-pitched, rumbling diastolic murmur. Angina, you feeling faint, dizzy, fatigue, palpitations. And calcium can build up in the valve in the old age, and you have aortic stenosis. It's a geriatric classification also. We see aortic stenosis. While I take class about the geriatrics, I talk about aortic stenosis. If you have diabetes, cholesterol, high blood pressure, chronic kidney disease, radiation, these are all the risk factors. Aortic stenosis can cause heart failure, stroke, clots, bleeding, arrhythmias, endocarditis, and death. Aortic insufficiency is now known as aortic regurgitation. You can see aortic regurgitation in ankylosing spondylitis, aortic dissection, congenital valve problems such as bicuspid valve. 2 flaps will be there. That's the congenital issue. It should be tricuspid. It is bicuspid. Endocarditis, high BP. BP is a condition we have to talk elaborately because we give Sarpagandha. Sarpa Sugandha is told first time in Ashtanga Hridayam, in Dandi Garidagi Avalegam. In Dandi Garidagi Avalegam, the word Sarpa Sugandha is coming. That Sarpa Sugandha is not Ravalfiya. That Sarpa Sugandha is Ishwaramuli, Garadakudi. So what is Sarpagandha? Susurdam, Uttaram, Vishajigisa. The word Sarpagandha is mentioned. Sarpagandha is basically a Vishagara Dravya. How does Sarpagandha came into existence in clinical practice? How every company is making Sarpagandha as a tablet for hypertensive management. Sarpagandha produces depression, suicidal thought is a myth. It is, I have never seen anybody suiciding. And keeping away Sarpagandha, how will you treat hypertension? All these things need clarification for younger generation. So systemic lupus erythematosus, trauma to the SLE, aortic insufficiency. So in any rheumatological disorders, my dear doctors, whether you get rheumatoid, whether you get IAS, or any type of Vadaraktam spectrum of diseases, you see uveitis, iritis, thyroiditis, aortic insufficiency, pericarditis, ulcerative colitis, Raynaud's phenomenon, and vasculitis. These are all the extra articular complications of the rheumatoid spectrum of autoimmune disorders. So in aortic stenosis, pounding pulse, fainting and all, sometimes you will be taking BP, BP will be very high, 160, and the diastolic will be 40, 45. With that also we will be able to diagnose certain thing. Shortness of breath with activity on lying down, waking up of shortness of breath sometime after sleep, swelling in the feet and abdomen, low diastolic pressure. That's what I told. 160/40. You can diagnose just by checking the BP. You can tell the aortic problem. Pulmonary effusion, aortic insufficiency may be seen in tests like echocardiogram. Echo has become a very nowadays doctors, physician assistants. They do the echo. Transesophageal echo is sometimes done. People with angina, congestive heart failure due to aortic insufficiency do poorly without treatment. Now, mitral stenosis cases are becoming less nowadays because rheumatic fever is almost eradicated. Once I went to America and talked about mitral stenosis and amoebiasis and filariasis, they told they have not seen these cases at all. They talked about Lyme's disease. I told I have not seen Lyme's disease at all. I have not seen multiple sclerosis at that time. Now in India, we see a lot of multiple sclerosis cases even in Kanyakumari district. Previously, we were not seeing autism. Now I don't know whether our diagnostic skill has improved or not. We are able to pick up a lot of pervasive developmental anomaly cases. Mitral stenosis can make the person tired. Rheumatic fever, streptococcus infection. It licks the throat and bites the heart. Beta hemolytic streptococcus. So you have shortness of breath, heart palpitation, and hemoptysis. Hemoptysis, blood with sputum. Rapid heartbeats, irregular heartbeats, they come. Heart is then affected. They have severe dyspnea. It occurs between the age of 15 to 40. Arrhythmias are very common. So again, it is a Vada Rogam, and there is pleural effusion, strophem. I give Dasamula Kashayam, Punarnavadi Kashayam, Brigatyadi Kashayam, Dasamula Danvantara Gudiga, Dasamula Haridagi, Hamsa Karidagi, Dasamula Rasayanam, Arjuna Arishtam. In this condition, they respond very well. Congestive cardiac failure, strophem. Congestive cardiac failure is a condition that occurs when the heart muscle, either result of weakness or stiffening, is unable to pump the blood. Shortness of breath when the patient is lying down is the cardinal feature. The night they keep more pillows, they have dyspnea, either it can be congestive cardiac failure or bronchial asthma. The midnight they come and wake you up, symptoms fatigue and weakness, edema in the legs. Edema in the legs is a very big topic. I would like to take one class on edema. Edema and sofa. It's a very interesting topic. Irregular heartbeat and inability to exercise, intolerance. We have a 6-meter test. Persistent cough or wheezing with pink blood-tinged sputum. Increased tendency to urinate at night. Water retention, so more weight. Sudden shortness of breath is commonly seen. Heart failure can occur. The ejection fraction is more than 50. Heart gets 100 ml of blood, 50 ml it keeps, 50 ml it gives back. So the heart failure that's called ejection fraction. Ejection fraction is greater than 50 in echo. You see EF in echo. So, a heart failure can occur even with a normal ejection fraction. Generally, heart failure begins with the left side, especially left ventricle, and then the right side. So, chronic causes of heart failure, diabetes, HIV, hyperthyroidism, hypothyroidism, iron accumulation, hemochromatosis, and amyloidosis, protein accumulation. You know that Lewy body dementia and all we talked on the last class. Lewy body dementia, Lewy body proteins in kidneys. Left-sided heart failure is the most common form of heart failure. Fluid may back up in the lungs, causing shortness of breath. Right-sided heart failure occurs with the left-sided heart failure. Fluid may back up into your abdomen, legs, and weak. Left-sided heart failure, lungs. Right-sided heart failure, abdomen. That's very, very important. Diastolic failure and systolic failure. Diabetic medications like rosiglitazone, pioglitazone, they correct the insulin sensitivity in non-alcoholic fatty liver disease and all. It's very good. They produce water retention in the body and they are found to have some cardiac complications. So very few people nowadays, selectively modern doctors write that. Non-steroidal anti-inflammatory drugs, some anti-anesthetic drugs, and anti-arrhythmic drugs, verapamil, amiodarone, certain medications to treat high blood pressure, cancer drugs, psychiatric drugs, QT interval and psychiatric drugs, QTC interval. It's a very long topic. Lung conditions, inflammatory conditions, obesity, irregular heartbeats, restriction of sodium in the diet. Ayurvedically, acute failure we cannot manage. Chronic failure, you can give Viradharadi Kashayam, Brigatyadi Kashayam, Sofa Jigissa, Sundi, Punarnava, Eranda, Panchamula Kashayam, Varunadi Kashayam, Ardhavilvam Kashayam, Sukkusunda Kadaladi Godutua, Adil Nerbagadi Punarnavam, Dasamulam is Sofagnam according to Charaga, Dasamula Kashayam, Patya Punarnavadi Kashayam, Danvantara Gudiga, Chandra Prabhavadi, Rasonadi Vadi, Rasonam is Hridyam, Sringavaspam, Dasamula Haridagi, Arjuna Kshirabag. 3 medicines are enough. I am giving you the choices. No need to write all the medicines. If you go to a hotel, idli is available, puri is available, dosa is available. You will not take everything. You will take whatever you want. Kalega Bodhanayam, Chiradadinyayam, all these nyayas are there, Hypertension. I always consider systolic as Vada Pitta, diastolic as Vada Kapha. I have got my own logics to talk about that. Hypotension. Many people use the word hypotension wrongly. Actually, 90/60 with the symptoms, very rarely we get sudden blood loss, severe infection, severe allergic reaction, and Addison's disease, cortisol hyposecretion. You get that. Very rarely you get hypotension. Orthostatic hypotension. You will be lying down. Once you get up, after 3 minutes, BP will come down and you get murcha. Sometimes this postprandial orthostatic hypotension will come. That is immediate after eating, all the blood will go to the stomach, brain, the blood supply will be less, and you get giddiness, hypotension. You have blurry vision, confusion, dizziness, syncope, lightheadedness, nausea, vomiting, sleepiness, weakness, or rasadushti. Thyroid condition, Addison's disease, hypoglycemia. Nowadays you have a self-monitoring blood glucose apparatus. Less than 70 is hypoglycemia, less than 90/60 is hypotension, less than 50 you need hospitalization. Some nervous system disorders, Parkinson plus checking BP in sitting position, standing position is very, 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 very important. Pure autonomic failure, amyloidosis. Some people have low blood pressure even after meals, common in old age. Certain medications like diuretic, beta blockers, calcium channel blockers, AC inhibitors produce that, antidepressants produce that, muscle relaxants produce that. So you can do hypotension, why it is coming, sugar you check, hemoglobin you check, ECG you check, and Rasakshayam Murcha Chikisa usually we give, and we will be Kadurasa Pradanya, Pitta Vardhana, Aushadas, Varunadi Kashayam, Kasturi Gudiga, Purna Chandrodayam, Trikadu tablet, the Kadurasam will remove the Mandada, it will improve the circulation, Pitta Vriddhi, Vada Vriddhi takes place, so circulation will be improved. In chronic cases, Panchagavi Girdam, Lashunadi Girdam, Hindu Savarchaladi Girdam, all taken from Gulma Chikissa, Brahma Rasayanam, Pipalyasavam, Draksharishtam, Arjunarishtam, Arjuna Kshirabhagam. Pipalyasavam, many people think main ingredient is Pipali. Only 50 grams is Pipali. 8 kilos Draksha. Punarnavasavam, many people consider Sofakanam, considering Punarnava is the ingredient. But Punarnava is only 50 grams. 8 kilo is Draksha, that is Madhurarasam Sofakanam. In Vada Sofam you have to give. Right heart failure you have to give. You cannot give it in Kapha Sofakanam. But Punarnavasavam, if you know Punarnavasavam contains only 50 grams of Punarnava, you need a teacher to tell that. Otherwise, how many yogas you will be able to study? Hypotension, again, all these medicines, painkillers, arrhythmias, dehydrations. Atherosclerosis. Damani Pratichayo Damani Upalepaha. Atherosclerosis is hardening, blockage of blood vessels produced by Kafadadu, Mandaguna, Stiraguna, Amayukta, blocks the Raktadadu. It can happen in carotid artery. Smoking can produce in legs, thromboangiitis, obliterans. Chronic diabetic can produce PVT, peripheral vascular occlusive disorders. And atherosclerosis can produce heart attack, stroke, headache, facial palsy, numbness, high BP, kidney failure. You need an angiogram, ankle brachial index, blood test, chest X-ray, ECG, cholesterol test. Cholesterol, we disagree with modern medicine in the concept of cholesterol because we feel when there is Vada Vitta Vriddhi and Agni Vriddhi and Kapakshaya, Gridam is needed. Gridam is very important food in our culture. Thousands and thousands. I have seen my grandfather chanting Charaka Samhita. He had memory loss in the last part of the life. He could forget certain things, but he did not forget Charaka. So I realized the importance of Grida. Varunadi, Vara Asanadi Kashayam. Shadadaranam, Amasegadavadam. Amasegadavadam can be gastritis. Amasegadavadam can also be interpreted as unstable angina. Vyoshadi Gugulu, Rasonadi Vadi, Gugulu Vajavaram Takaram, Kapakaram, Vadagaram, Srodoshodanam, Anulomanam, Pramadi, Ushnaviriam, Kadurasa Pradanyam. This is how atherosclerosis is treated. Ischemic heart disease, coronary artery disease, ischemic heart disease, we will be giving Rasona the Kashaya. Rasona, Karavi, Krishna, Stira are given. Then Kasturi Gudiga, Dhanvandaram Gudiga, Arjuna Arishtam, Dasamura Arishtam, Vardhamana Pippali Rasayanam are given in ischemic heart disease. For ischemia, single drugs, Shunti, Vacha, Lashunam, Pippali, Nagavalli, Kasturi, Amalaki, Arjuna, Abamarka, Ajamoda. Ajamodam is a very good cardiac protective drug. Many people do not use that. Rasayanam, Brahma Rasayanam for Vada, Shavanaprasam for Pitta, Shilajit for Kapha, Agasti Rasayanam for Kapha, Lashunam for Kapha, Triphala for Tirdosha. Metabolic abnormalities in cardiovascular diseases. Hyponatremia, low level of potassium, hypoazotemia, hypokalemia, low potassium, hyponatremia is sodium. Diabetes mellitus in heart and heart. Diabetes is equal to coronary artery disease equivalent. So hypertension, peripheral vascular disease, dyslipidemia, LV dysfunction, diabetic cardiomyopathy. So many cases. We manage it very well. Do you believe that? Obesity and heart disease, coronary heart disease, stroke, dyslipidemia, DVT, Varunadi, Punarnavadi, Shivaguliga, Vitanga Yavalogadi Churnam, Ayaskriti, which contains Asanadi, Vatsagadi, both are Kafagara, Medogara, Trifala, Prade Madhivudam Vari, Tatsigram, Staulyanasana can also be applied. Hypothyroidism and heart. Diastolic dysfunction. Again, Vata Kapha, I told diastolic is Vata Kapha, cardiomyopathy, heart failure, pericardial effusion, elevated homocysteine, Punarnavadi, Varunadi, Desamulam, Patya Punarnavadi, all the. I tell you, you can practice all the systems of medicines of Ayurveda with 30 to 40 medicines. Other systems, other medicines, many medicines we tell for class purpose only. When I was starting my career, I was using lot of medicines. Now I limit my medicines to 30-40 medicines. If you know the 30-40 medicines thoroughly, most of the clinical conditions can be treated successfully. Samaya ayo.
10 minutes.
Hypothyroidism and heart. Vayu Guliga, Kanchanara Gugulu, Arjuna Kshiravagam, Sukha Virejanam with Trivrit. In Hridyam, Hridrogam, Sukha Virejanam has to be given. Artha Vilvam Baniyam. Artha Vilvam does not contain our Vilva. Vilva means one pala. Then hyperthyroidism affects the heart. Arrhythmias, tachyarrhythmias, ECG, you have to take sinus tachycardia in ECG, shortness of breath, atrial fibrillation. Tesham pradana prasame prasamaha. If you treat hyperthyroidism, Vadavitta Samanam, Madhurasam, Snigdagunam, Gurugunam, Stiragunam, Brahmanam, if you treat hyperthyroidism, automatically arrhythmias will come down. Hypothyroidism, you can treat easily. Hyperthyroidism, cases are very less and very difficult to treat. It is very difficult to replace neomercazole and beta blockers. Hyperthyroidism is tough, I tell you. Atrial fibrillation, you see there is an ectopic also. There is an ectopic also, varying RR interval, no P waves. There is interventricular conduction abnormalities also seen. Now, sinus tachycardia, you are seeing the PQRS complex. The heart rate is around 130. You see this? There is a non-specific T wave inversion in V1, which is not very important. And mitral stenosis, you have got this EKG, rheumatoid arthritis and heart. In rheumatoid arthritis, rheumatoid arthritis can affect the heart. Not only rheumatoid, accelerated coronary artery and cerebrovascular atherosclerosis, silent ischemia, aortic incompetence, early myocardial infarction and sudden death. Ankylosing spondylitis, young men with kyphosis, aortic valve is involved. They need an echo. Conduction abnormalities, you see these interventricular conduction abnormalities. First degree heart block, second degree heart block, third degree heart block. Heart rate goes below 40, you need a pacemaker. There are few village people who are totally poor. They came to me. I gave Resonadi Kashayam, Kasturiyadi Gudiga, Purna Chandrodayam, and Dasamularashtam I have given. They are doing well with the medicine. They are afraid of pacemaker. They do very well with the medicine. And I give Tambula Swarasam in that case. Dravya Samanyam, Guna Samanyam, Karma Samanyam. Hypoproteinemia. Cardiac complications. Arterioventricular blocks in scleroderma. Scleroderma is a very tough disease, I tell you. Cardiogenic shock, arrhythmias, pericardial effusion, myocardial infarction, heart failure and pulmonary hypertension. Suppose I ask you, you get a case of pulmonary hypertension, the patient comes to you, he says, I have dyspnea, I have pulmonary hypertension, this is the report. How will you put a guna samprapti? How will you select the medicine? What are all the investigations you take? You can tell Ayurveda doesn't talk about BP, Ayurveda doesn't talk about menopause, Ayurveda doesn't talk about hypertension. So, E swasta, because prasanna varnendriyam, indriyartha ichannam, avyarada bhaktavegam, all these things are there. Samadosha samagnis are there. Now, there are Gudalinga Vyadi, there are Avyakta Vyadi. Gudalinga Vyadi, already I told how one fellow fell down by Savanaprasa Rasayana. We missed that, and he had ketoacidosis. You would have heard this story. Atrioventricular heart block, cardiogenic shock, arrhythmias, pericardial effusion, myocardial infarction. You see, you should study. Morning, you should get up by 2:33. You study Ashtanga Sangaraga. Afternoon, you study Siddha. Night up to 11 or 12, you study modern medicine. You study, and study. Nothing will give you happiness like studying and teaching. You get ecstasy, clinical ecstasy in studying. My dear student, study well. Hard work cannot be substituted by any other thing in the world. I was a bad student. I got a good guru. So the good guru made a bad student into a good student, and who made me to study. Because I have seen him studying at the age of late 70s in the midnight. He asked me to bring Kashapa Samhita, all these things. So I remember all these things with gratitude. Study from everybody. Don't blame any system. You be loyal to Ayurveda. Consider every woman as your mother. The mother who has given birth to you is supreme. So the Ayurveda is your mother. Don't blame Siddha. Don't blame allopathy. Don't blame homeopathy. There is no need to grow by blaming others. Why should we blame? Why should we criticize other doctors? Why should we criticize? We have to do our duty. What is the final question to be answered? How many patients you get? How many cases are recovered? How many classes you have taken? That is a practical thing to be assessed. One day patient will come, 2 days come. Will they come for 100 years? Are they fools? They are not fools. So you should teach after treating cases. You see this heart block, type 1 block, type 2 block, and type 3. The arteries it is around 40 only. They need a pacemaker. Now, with this topic, I think I have talked sufficiently. We will continue it in the next class.
23rd and 28th.
We will try to meet you on 23rd or 28th. We will continue cardiology, and I will be talking about neurology, rheumatology, pulmonology, endocrinology, gastroenterology, psychiatry, immunology. It is a joy to talk with you. If you have questions, ask me. எங்க இருக்கு? Aspirin substitute, gomutram. Gomutram is a substitute. Gomutra haridagi, tambula swarasam, vacha, pippali, solpala suna vindam.
Management of hypo. Management of
hyponatremia, sodium potassium imbalance. Next class I am going to talk about it elaborately. Electrolyte imbalance and Ayurveda. Echo is disturbing. Echo and ECG are not disturbing. They are useful. Acute MI. Kasturigal Parasayanam, Kasturi Guliga, Dhanvantara Guliga, Tambula Surasam. Then basic modern medicines you should keep. After bypass surgery, we have so much to offer, so much. Kavadagaram, Gulma Chikissa, Rasonadi Kashayam, Dhanvantara Gudiga, Lasuna Kshira Bhagam, Sugumara Legium for Nitya Anulomanam. Ajkala is my student. SLE has got cardiac complications. I told interstitial lung disease and Sangeeta Jesudas. Irregular heartbeat, chala guna, dushti, vishama gadi in rasadadu, stira moola kashayam, danvandara gudiga, brahma rasayanam, sugumara kashayam, lakshadi tailam, danvandara tailam, uro pichu are useful to reduce the stress, talam and manasamitra vadagam in can be given. Musculofacial pain treatment. Now we are talking about while you are thirsty, you should not ask for a fountain pen. Vasodilator, Tambula Sorasam. Platelet, anti-platelet aggregation inhibitor, Tambula Sorasam. Oro Nirdibam. Arjunadivadi can be given, of course, in Kapha Hridrogam, Pitta Hridrogam. Even sometimes Pitta Hridrogam reflux can manifest like Pitta Hridroga. There Guduchadi, Drakshadi, Kamadugarasam, Sangavadi will work. Parushagadi, Avalegam will work. Arjunadivadi can be definitely given. It is a very good yoga. Prabhagaravadi, Arjunadivadi. We are going to talk about that. Only 40% of the class we have finished. Okay, thank you. Thank you very much. Namaste. Namaste. Thank you. Thank you. Thank you. Has asked an important question. One by one question has come. To study properly, what should we do? You should study properly. That is the answer. My dear students, we had some disturbance. I am very sorry for that. And technical disturbance. Technical. This happened. And I am able to present the paper. I do not know anything other than the subject matter. This class is dedicated to my brother, my son, my secretary, my friend, Mr. Saju Ramachandran. If he is not there, this class would have been a flop. So I thank him. And nowadays, because everybody is started webinar, I think this speed and other things are creating problem. All the last 30 seminars, we didn't face any problem. Now we face problem. Punarnava is useful. Yes, right heart failure, Sophagram, Tiktarasam, Sophagram, it is useful. Many questions. You send the questions to Mahadevan101@gmail.com. Next class, I will answer everything. Everything I will answer. Everything. Mahadevan101@gmail.com. You write WhatsApp number.